Were you told that you had a slip disc or a disc bulge? Hi, I'm Dr. Kim Carlucci from Montclair, New Jersey, and today we are going to explain exactly what a disc bulge is. The intervertebral disc is a special type of cartilage that connects and cushions the 24 bones of your spinal column. Each disc attaches to the vertebra above and below, and it provides the proper spacing for the pairs of nerve roots to exit the spine from between each joint. A disc can thin, wedge, bulge, protrude, tear, or herniate, but it does not slip. Safe and natural chiropractic care can help. Each spinal disc has a jelly-like ball-bearing core that is contained by bands of fibrous tissue. Healthy discs provide flexibility and they allow normal bending and turning, and movement produces pumping action and supplies proper disc nutrition and waste removal. Trauma produces the most common form of this injury. Spinal misalignment can cause the tissue to adapt to a wedge-like shape. This is the earliest stage of this damage. While this position can encroach upon the adjacent nerve tissue, pain or other obvious symptoms may not be present. Even before symptoms appear, chiropractic care is super helpful. Like a blister, disc tissue can bulge. As the soft nucleus of the disc is compressed, it pushes toward the disc wall at its weakest, and this distortion can produce obvious symptoms like sciatica, for example, and its affects nearby nerves. Muscles tighten to protect and splint the joint, and chiropractic care has been shown to help with that too. The most extreme form of disc damage is when a disc ruptures and it's leaking its contents into the surrounding tissue. With its cushioning and separating functions gone, movement is painful and surgical intervention is sometimes involved. Uncorrected, long-standing subluxation can make this susceptible to damage. "I didn't do a thing," or "I just bent over to tie my shoe," are common comments we often hear. So how does chiropractic care help disc problems? The purpose of chiropractic care is to locate and correct areas of the spine that interfere with proper nervous system control of your body. Because the intervertebral discs are so close to the spinal cord and the nerve root, disc involvement is quite common in chiropractic cases. Chiropractic adjustments help to restore proper motion and position a malfunctioning spinal bones, reducing nervous system involvement. If caught before permanent damage occurs, disc tissue often returns to a normal size and shape. You may ask, aren't these problems simply part of the normal aging process? Well, the answer is no. However, many disc problems are the result of years of neglect. Many spinal problems are non-symptomatic until the advanced stages of degeneration. Many elderly patients who have maintained their this one's not